Hi, this video is right before hair transplant surgery, and patient is here for us to restore his hairline. Um, and hair transplant, as you know, and I mentioned many times, is not just about surgery. It's an art, and you need both an artist and a surgeon to give you the most natural hairline. And I mentioned many in my video. It's not like our grandfather hair transplant where we should be just to be happy to have hair. Nowadays, hair transplant is not good just to have hair. You want to look so natural that no one knows you have had surgery. And you see he has a pretty significant hair loss, and from the front to the back. He's around, class 5. And so we want to lower the hairline, bring the tempo as well. So if you can tilt up for me, there you go. And we're gonna adjust and show and zoom in so to show the audience what's the hairline. So he has a widow's peak already, so I'm not gonna change his widow's peak. So we're gonna keep that, and we'll base from that and then transplant through them because this weakening is on the way out. So with that widow's peak from here, and we just curve out here. He has a slight curve on both sides, and again we want to make sure that we're proportional vertically and horizontally as well. So we brought in both tempo. You can see here, and it's slightly tilt back too. It's not nickler. And then we work from the front to the back. We transplant rows and rows, single hair graft in the front, followed by a mixture of 2, 3, and 4 in the back for volume and density. But the front you want to be very soft, so that's why we transplant single hair graft. Hair transplant, the angle of the hair is important. Start around 35, 45 in the front, increase when you go backward, changing in a different direction. The goal in the front are different than the back. The goal in the front is about naturalness and softness and density here. The goal in the crown or in the middle and those stuff is never about softness or naturalness. It's still going to be natural, but the main goal is about density. So you have a more mix of a larger root. And so selection of hair graft is important. The angle is important. And the other important thing is for Caucasian, from the mid eyebrow to the hairline, from 6.5 to for Caucasian around 7.5 to 8.5 centimeter. For Asian and African Americans, from 6.5 to 7 centimeter. Again, those are the bell curve, the main one. But you can always have a skewer on both sides. The other important factor is the zigzag. Now, you have the soft hairline, which is more on the older client, who are more mature and they don't want to appear draw attention, so they have a bigger zigzag. The great thing, it looks so natural and so soft, but the drawback is the density looks a little bit less. On the other hand, if you do a tight hairline, it draws too much attention. So most people would prefer a medium or medium type. If you have, if you have very thin hair, then people prefer the medium type because you want to push an envelope, but density still looks natural. And then if you have thick hair, you can get away with medium hairline because medium zigzag. So the zigzag is what we talk about. I'm very excited for him because it's going to completely transform his looks. He's been using kabuki and other stuff to help camouflage and give the density. Yes, those stuff, when you sweat, it runs. And then he has a very pale white skin, so with the contrast of of curly hair and dark hair, you can see through the scalp easier. That's why the camouflage works well. But again, it's not your real hair. You want your own real hair. And once the transplant done, hopefully he'll come back for us to film him a year later. And we're gonna see. I'm excited because it will look different for him. And hopefully he'll allow me to show him full face. We'll see.